सो सबसे पहले जब पेरेंट्स पहले दिन हमारे यहाँ आते हैं बच्चे को लेके, हम सबसे पहले उनको यही बोलते हैं कि अगर आप इन्वॉल्व होने वाले हो तो हमें इंटरवेंशन करने का मौका दीजिए, अदरवाइज मार्गा इज नॉट द स्पेस फॉर यू. अर्ली इंटरवेंशन इज अ बिग बिग ग्रीन फ्लैग एंड यू डोंट हैव टू थिंक लाइक दैट बड़े होंगे तो ठीक हो जाएंगे, जैसे जैसे और टाइम बढ़ेगा तो ग्रोथ हो जाएगा. देयर इज नो हार्म इन जस्ट गोइंग एंड showing somebody for one consultation to just be sure that it's all fine. You know, ignorance is not going to help anybody. Arts-based therapy and alternative methods of therapy really work very well with children with special needs, specifically autistic children. There should be a massive spontaneity and energy, and with that energy, a sense of calmness in the educator who's there. It's a very good combination of being a little chirpy yet having a sense of calm, which relaxes the child.
Hello everyone and welcome back to the India Autism Center podcast, your trusted space for real conversations, expert insights and practical guidance on autism, neurodevelopmental care and inclusive living. I'm your host Saudamini Sharma and today we will discuss autism and therapy with Ms. Mansi Sangvi Bayani. For those who don't know, Mansi is a counseling psychologist and RCI registered special educator who has worked closely with children and families, helping them navigate therapy with clarity and practical support. She runs Marga Wellness Studio and is closely associated with India Autism Center as well. Welcome back, Mansi. This isn't Mansi's first time with us. She's been a part of our podcast before. If you'd like to revisit those conversations, you can find them on our channel.
Hi, Saudamini.
Hi.
Yeah.
Okay, I'm just going to dive right in.
Absolutely.
Many parents seek therapy soon after a diagnosis, often feeling overwhelmed by the word autism. To set the foundation of our conversation, could you please explain why therapy at an early stage is important?
As we all know, our foundation for anything lies from our very early years. Because when children are actually born, they're like a blank slate. And the experiences that they gain and they gauge over the period of time, through their school, through their parents, through the environment, through the classes, etc., 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 all the exposure gets them to be who they are. Right. So anytime when we see that there is any form of any kind of a developmental problem, or you see any kind of a red flag, it could be as simple as the child not having just a basic eye contact, and then you going to a psychologist and the psychologist telling you that it's okay, this is not a problem.
Right.
Probably the child is just a little distracted, or you can just do these few activities and get or maybe just for fine motor, gross motor. But anything at the earliest stage, if you help them, it'll just help your life get easier. You will have more number of years to work upon it. And till the time they become independent, you'll have so many more strategies, so many more exposures for the child in order to make them more independent and just make their lives easier as well. Early intervention is a big, big green flag. And you don't have to think like that बड़े होंगे तो ठीक हो जाएंगे, जैसे जैसे और time बढ़ेगा तो growth हो जाएगा. There is no harm in just going and showing somebody for one consultation to just be sure that it's all fine. You know, ignorance is not going to help anybody.
Yeah. Before we continue, here's a quick look at who we are at India Autism Center.
Imagine a space designed not just to care for individuals with autism, but to empower them. A place where knowledge grows, support flourishes, and possibilities expand. This is India Autism Center. It is built to redefine how we approach autism. Through education, research, and community-driven initiatives, we create an environment where individuals with autism can thrive. Samavesh, our residential campus, is designed for individuals with autism to live, learn, and grow with dignity and independence. It is more than just a place to stay. It is a space to belong. Manan, our training academy, prepares professionals to provide specialized care. Through structured programs, we equip individuals with the skills to support neurodivergent communities with confidence and compassion. Khoj, our research division, is dedicated to advancing our understanding of autism. Through data-driven studies and collaborative research, we work towards shaping the future of neurodiversity.
Some parents come in wondering whether therapy means changing their child. How do you usually describe the real goal of therapy when you speak with families?
So see, specifically if you're catering to autism right now, then it's to be there are समझ लो 6 divisions है, ठीक है? When we are treating or doing an intervention for a child with autism spectrum disorder. First is there is a behavioral part, there is a social adaptability part.
Right.
There is a part where there is academics involved because obviously they have to become independent eventually. There is daily living skills. That is a very important part because that's going to allow them to vocationally do something in their life, etc.
Yeah.
Apart from that, there is something which is very necessary, which is emotional regulation, which allows them. So all of these parts are taken into consideration along with rigorous parental training or caregiver training.
Yeah.
So ये सारे aspects के basis पे एक intervention create किया जाता है. Along with all of this, a lot of sensory care,
Right.
a lot of support in terms of physical movement, physical health, nutrition.
Yeah.
So it's a very holistic kind of an intervention plan
Yeah.
that should be created along with a very strong counseling behavior modification base. And again, if it's done at a very early stage, every 6 months to 1 year, the modifications of long-term and short-term goals will just make life easier for the parents, for the special educators, for the school as well as the
Right.
child.
Yeah. That makes so much sense. That's great. Can you describe what actually happens during a typical autism therapy session?
Absolutely. So, the first thing that we need to be prepared as therapists and as special educators that it's going to be very, not very organized. A lot of us want the session to be absolutely perfect as per our intervention plan, etc. No. So the first thing that I always suggest everybody is that there should be a massive spontaneity and energy, and with that energy, a sense of calmness in the educator who's there. It's a very good combination of being a little chirpy yet having a sense of calm, which relaxes the child. There should be a lot of teaching, learning materials involved. There has to be a well-divided and planned session where there is a mindfulness activity, where there is a focused goal which you're working upon. It could be a daily living skill, emotional regulation, academic skill, whatever. Towards the end, there should be a good summarizing, a good making them understand that these are the things you have to go back and do at home. Giving them like a flashcard or something which relaxes them in the sense that, you have to take this home with you, checklist it and then come back the next day. It helps the parents also to know what we have done in the session. And towards the end, just take a walk out with the child. Make the child reinforced, saying with a smiley or with some reinforcement positive that they've done a good job. And if it's not a good job, then a negative reinforcement, yet something motivating towards the end, then I'm expecting something better out of you the next day.
Right.
And in all these practices, there are many more technical things, like you use your different CBT, ABA, any kind of an approach that is required. But generally, a therapy session should involve these things. It should surely have movement, rhythm, play, any of these at least for 10-15 minutes within whatever goals that we have.
Right. So, what are some techniques therapists use to help a child feel safe and comfortable, especially in the first few sessions?
So, as I mentioned, arts-based therapy and alternative methods of therapy really work very well with children with special needs, specifically autistic children. A lot of different modules in the sense that you use rhythm, movement, play. Play works wonders with them as well. Something which is very non-judgmental, not very restrictive, yet something which has more space to them. They know from the beginning they are not going to be controlled. They have the liberty to do everything that they want to, and then slowly we filter and bracket them over to the goals that we need to.
Right.
And a lot of positive body language.
Right. Yeah.
They should feel welcomed. They need to feel a rapport with the therapist or the special educator. There has to be a very positive form of smile, energy, warmth, lot of tools and TLMs and sensory things around them. Again, very structured, not like you just give everything on the first day and they're all hypersensitive by the end of it. Greenery really works. So generally what we try is we take them for walks in the park. We talk to them a lot. We just have to understand their language of talking.
Right.
It's not always necessary that it has to be jargons and a lot of vocabulary and a lot of talking. And one technique for sure that works is they really like non-judgmental people and they recognize it.
Right.
They know who's judging them, they know who's going to control them, and they know whose body language is not very positive towards them. So these three are really key.
Yeah.
For sure.
Right. How important is the role of a parent in the therapy process, and how are they usually involved? Could you give us an example?
Bilkul. So I'll tell you a few things that we do at Marga, that'll give more perspective.
Right.
So सबसे पहले जब पेरेंट्स पहले दिन हमारे यहाँ आते हैं बच्चे को लेके, हम सबसे पहले उनको यही बोलते हैं कि अगर आप इन्वॉल्व होने वाले हो तो हमें इंटरवेंशन करने का मौका दीजिए, अदरवाइज मार्गा इज नॉट द स्पेस फॉर यू.
Right.
We will take the ownership of everything, but there has to be participation, acceptance to a lot of guidance,
Right.
and transparency between us in order to know what your goals are, what our goals are. We will negotiate. What your expectations and fears are, what our expectation and fears are, we will negotiate. Everything is negotiable, but there has to be communication.
Right.
So consistency is expected out of parents. Communication is expected out of parents. Being active in the WhatsApp groups. Giving us more videos and pictures of the child at home. Doing positive as well as negative things. We also send the same. There are regular parent-teacher meetings. They're regularly called in to observe sessions of our special educators so that at home also they are doing the similar kind of caregiving, because it has to be a very, very close-knitted and a very holistic kind of a approach that needs to be taken.
Right.
If I'm doing a lot here, but ghar jaake the parents are only complaining कि घर पे तो नहीं कर रहा है. So the effort has to come from there as well.
Yeah.
And for that, I'm sure they take a lot of effort, but generally what happens is it goes a little in the wrong direction.
Okay.
Because they're probably doing it in their traditional ways, or they have siblings now, they can't do two different things with two different people. So that becomes very confusing for the parents. So guidance and education will really help a lot of parents. So I think that's how it is. And then we also take them for celebrations. We also appreciate them, motivate them, do workshops for them, etc. We tell them that you guys go for a movie. We'll keep everybody here. Go have some fun and come. Because their glass also has to be a little full.
Yeah.
They can't be sort of all empty, tired, burnt out. If that is so, then the child is not going to benefit anything out of it.
Definitely.
So their mental health is extremely very important.
Definitely. So we often talk about therapy for young children, but what about autism adult therapy? How does therapy support autistic individuals as they grow older?
That's an amazing question, and I'm so proud that we've lately been able to create a community. IAC has also helped us a lot. So we've just started a special ability entrepreneurship wing.
Oh, wow.
Where we have around 15 of them who came to me one day saying we are not able to celebrate our birthdays. We are at home doing nothing. Comorbid problems are increasing. They are becoming more obsessive, more anxious, more fearful, less confident. So we want to do something. The parents are also like, we want them to do something. So we were like, let's begin. Everybody take out 2,000 rupees right now. We created a bank account for them. We said, let's go and buy some important raw materials and let's just start making something and let's start selling it. I will buy them for you.
Yeah.
I will make sure they are sold. That day and today now, it's been a year for Kala Marga and they have changed as people. They are just like you and me.
Yeah.
They also want to go to a mall. They want to go buy from Spencer's. They want to watch a movie and they want to go to Insignia and watch a movie. They probably want to do everything that all of us want to do.
Of course.
So I think it's very important because early intervention has not been a very common thing for these adults.
Right.
Because awareness was not there when they were young. So I feel it's late, but it's never too late.
Never. Yeah.
Never too late.
Never too late.
It's just that hope and that faith and that encouragement should be there, and love really makes them melt down. And all their obsessive habits, especially for moderate and mild ASD, it's wonders. They really transform and change. And so is IAC and Amrit Somani and all these organizations encouraging a lot of vocational training, which is very essential.
Yes.
So doing all daily life skills as well as trying and giving them a job, making them do daily chores, etc.
Right.
These are the best ways in which we can have
Yeah.
adults with
Makes
autism.
them feel more whole because of the regular
And सबसे
lifestyle
parent का
stuff.
तुम्हारा मेरे parent का आज क्या question है? बड़े होके तुम लोग रह पाओगे ना?
हाँ. Yeah.
So वैसा ही
So that
environment
also,
बनाना है.
yeah.
And IC is also coming up with this lovely setup. So I think that place is
Yeah.
also going to make them super independent.
Right.
And they'll have their own community and their own space which they can call their own. So
Definitely.
yeah.
If you're watching this and it resonates with you, don't forget to hit the like button. Finally, Mansi, if there is one message you want parents to take away about autism therapy and their child's future, what would it be?
So Damini, first thing I really like to tell the parents is that you all are already doing a great job. And you guys need to have faith in yourselves that whatever information is around y'all, take it slow. Don't try and implement everything on your children. Everything has to be one step at a time. Don't keep changing organizations again and again.
Mm-hmm.
That really does not create a base. In fact, sit with the organization, communicate with them, ask them what you require and need, and contribute in that as well.
Yeah.
So consistency is very important. Educating yourself is very important. So you should either take up a caregiving course or understand and learn the right way, the right methods, the methodology in which your child is going to benefit, rather than making the child adapt to what your styles are.
Yeah.
And third, very important thing is give them a lot of love and social validation. Take them out. Don't take shortcuts. Let them do a tantrum one day. Let them do their misbehaviors. Sensory issues might come up. Let them be.
Mm-hmm.
Let everybody around them know that yes, your child has autism spectrum disorder. He will behave like this. You have to adapt by him. He will not stop coming out.
Mm-hmm. Yeah.
And slowly, slowly you will see that everybody loves them.
Yeah.
They will always have that extra edge in a room.
Mm-hmm.
And people are going to support them and love them. It's just the ignorance around them that makes them uncomfortable around them.
Right.
So if we are confident about our children that they are going to make it, they will 100% make it. So that's a little bit that I would like to share to the parents.
Thank you, Mansi, for sharing your deep insights with us today and in such an authentic manner. For our listeners, if today's conversation gave you a new perspective on autism and therapy, make sure to like, share, and subscribe to the India Autism Center podcast. Until next time, check out the video popping up on your screen.